What if I told you there's a way for OBGYN practices to use the new set of Medicare codes that could almost add six figures to your annual revenue, most of which can be profit, and most OBGYNs don't think that they qualify? Today, we're talking again about Advanced Primary Care Management Codes, APCM, again, program from CMS, and while the name has primary care in there is still an opportunity for OBGYN practices to leverage these codes for those complex care situations where you have patients that you are managing those chronic conditions for you to take advantage of. Now, there are some nuances to this, and we'll get into all of that here today, but do want to give some examples for the offices. So we recently met with one of our OBGYN groups there in Washington State, and we were talking about ways to increase revenue, amongst other things. And they provide incredible care for high-risk OB and chronic GYN patients. They actually are a group that does a lot of really good ways to document that complex care and bill for it outside of the global. And so really impressed with their team. And as part of that, we were going back and forth on APCM. And so wanted to give a podcast related to some work that our team did to evaluate these codes and opportunities within the OBGYN space. So we all know that patients with chronic conditions have phone calls, care coordination, medication management, all of that stuff outside that's going on outside just a traditional visit. And so today we're going to talk about ways that you can actually earn revenue from that. So implementing an APCM program for just, say, 150 of your Medicare patients could add $60,000, $70,000 in new high margin revenue in that first year. And so that is a lot of profit because typically you're already doing this work. Now you've just got to document it and kind of go through some of the hoops and make sure that you qualify. But again, not very hard things to do when you look at the APCM rules. So as you guys know, APCM stands for Advanced Primary Care Management. It's a set of codes that were introduced in 2025 to pay practices for ongoing management of patients with chronic conditions. So think of this as like that monthly payment that you can do and get paid for all the care coordination, communication, and planning that happens outside of a regular office visit. So unlike other care management codes, APCM is not time-based, so there's no 20-minute stopwatch or things like that that are part of like CCM codes. And so it is an option for you to use. Now, important for you to note that you cannot bill for APCM services for a Medicare patient in the same calendar month that another provider has already billed it. So you do have to have a mechanism, especially in the OBGYN field, that you need to confirm that that patient doesn't also have APCM that's being billed by their primary care physician team. So that is just a little nuance you'll want to make sure. Again, if you were a primary care physician, you want to make sure that nobody else on their team is billing that as well. So that's a universal situation. The other thing is you cannot bill APCM simultaneously with other care management services like CCM, TCM for the same patient in the same month. So important to make sure that you have some rules around that as you track these patients. So obviously, like I said, name says primary care, but I do think that you can still qualify as an OBGYN. CMS did design this primarily for primary care, but the rules explicitly state that specialists who serve as a continual focus point for healthcare services for a patient can still bill for APCM. So they do not limit this to certain subspecialties. So for many complex patients who do have conditions that you're managing that are chronic, you can still qualify for this. Again, with the nuance that you want to make sure that nobody else is billing this for the patient. So it is critical to understand who qualifies for APCM. So the patient must have chronic conditions that are expected to last at least 12 months, which puts the patient at risk, just at risk, right? And so that's not negotiable. Now, one question that we do get is APCM, can it be used for messaging or managing non-chronic conditions? And the answer is no. So this program is specifically for ongoing management of long-term complex health issues. So let me just remind you guys of those three codes. I know we did a podcast on this, a couple weeks ago, maybe a couple months ago at this point, but I just want to review these one more time. All right, so there's three codes that you'll want to know. GO556, are patients with 2 or more chronic conditions. So again, GO556 is patients with 1 or fewer chronic conditions, which typically gets you about $15 a month. GO557, patients with 2 or more, which gets you just under $50. All right, and GO558, which covers patients also with 2 or more chronic conditions who are qualified Medicare beneficiaries. So this is things like individuals who qualify for Medicaid assistance with Medicare premiums and cost sharings. And that actually is just over $100 per month. So this is supposed to reflect kind of higher complexity, social risk, et cetera, with those patient populations. So as you guys know, unlike CCM, which bills based on documented clinical staff time, APCM is going to reimburse based on the practice's capacity to provide. Really, it's 13 defined service elements, and we're going to talk about those. We're going to talk about kind of 3 chronic conditions that may qualify for OBGYN specifically, and then a process to go through with these. So let's first make sure that a practice who bills for this has to be able to deliver all 13 of these elements, and they are initiation of the APCM service, obviously, capturing that patient consent, comprehensive care management, so including a care plan development, revision, 24/7 access to clinical staff or urgent care needs, continuity of care with a designated provider, comprehensive care planning to address all of the health issues that are going on, management of care transitions between settings, should that, again, be a necessity. Again, these aren't saying that you need to do this with every patient. It's being able to have the capacity to do this based on their chronic conditions. Any sort of coordination of home and community-based service providers, patient care education, medication reconciliation and management, documentation of all APM services in, of course, an EMR, consent and documentation that the consent was signed, health risk assessment, which is required annually, and then identification of and communication of available community resources. So now, again, you're not required to document time spent on each of these elements. It's just an attestation these services are available and being provided should they be necessary, again, in the realm of the chronic conditions that the patient has. All right, so before we get into the specifics of who qualifies, I do want to make sure that you guys know we have a couple resources for you guys. We've talked about them before. One is a margin playbook, which really talks about patient AR. The other is an eligibility tool that allows teams to train their front desk. It is super detailed, but allows you to bring that into your staff and understand what changes you may need to make in that front end process. So check those out. Links are in the show notes. All right, so let's talk about some OBGYN specific reasons why a patient may qualify for some of these chronic conditions and to be able to bill for APCM. Again, with the caveat that you've checked to make sure that they're not having any other APCM billed under another physician for other chronic conditions that may be going on. But think about your pregnant patients, chronic conditions like gestational diabetes, chronic hypertension, thyroid disease that you are managing. Those are opportunities where you may be coordinating care. You may be talking to MFM specialists, managing medications, answering their questions between visits. All of that work is billable under APCM. So every month that you're managing that patient's chronic conditions alongside their pregnancy, that could still qualify. Another opportunity is around chronic GYN conditions. So think about PCOS, endometriosis, chronic pelvic pain. These are not typically a one and done type of situation. You are managing symptoms, adjusting medications, coordinating with other subspecialists. And so that is an opportunity for you to bill for that. Again, if you're actually doing this work, right? I don't condone, billing just for the sake of billing, right? You have to make sure that these, that you're providing these kind of management services behind the scenes, which is what this is designed for. Another third is menopause, right? Midlife patients. So many of these patients are also managing multiple chronic conditions, hypertension, diabetes, osteoporosis. And so if you are the person in their life who is helping manage all of these things going on, that may be an opportunity for you to bill for that. Obviously, for myself, right, I, for the most part, for many years, only went to my OBGYN. That was the only person that I went and saw. So they were acting as my primary care provider as well as my OBGYN. So that individual in those situations, should I have chronic conditions, would have been able and qualify for billing for that. So again, you just have to recognize the nuance there. So just an often overlooked opportunity where you may be in the situation where you're managing these chronic conditions, you're managing behind the scenes care coordination, medication management, et cetera. And so these patients are coming to you to manage that. They don't have somebody else who's doing chronic care management behind the scenes elsewhere. So that is an opportunity for you to bill for that. So obviously, I do want to remind everybody about how you go about getting this started, right? What are the things you need to do? First and foremost, identify those qualifying patients, right? Looking for those Medicare patients with those chronic conditions. Again, kind of understanding, do they have one chronic condition or two or more chronic conditions? You could even, depending on your PM software, pull a report looking at those ICD-10s. Some softwares are not great at doing this. Others make it very easy. So it just depends on your system. And focus on the ones like we talked about, right? Those high-risk OB, chronic GYN, complex patients that you are managing. Your docs may know exactly who they are because it's oftentimes patients who are leaving messages, calling, that you're managing prescriptions, et cetera, behind scenes. Say you're not seeing these patients every month, but you are doing work for them. So again, that's an opportunity to bill for that. As always, any patient may receive these services as long as they are aware and consenting to it. You do want to make sure that they're aware of any sort of cost sharing that they may receive, because that can be a surprise for patients. So obviously next you want to build out that APCM infrastructure. And this is really important. You need to make sure that you do have all these systems in place to meet those requirements. So again, that's that 13 kind of steps that we talked about earlier. You also want to make sure that you're getting patients' consent, which one-time simple conversation. You'll want to make sure that you're creating that care plan. Again, likely you're already doing this. It just needs to be documented and shared with the patient. You have to ensure that you have 24/7 access for these patients should they need it. You want to make sure that you're leveraging, obviously, your nurses and MAs who can do the majority of the work under your supervision for the program, but want to make sure that they are aware of the workflows, you're aware of the workflows, so that runs smoothly. And then be able to identify the codes that you're going to drop on a once-a-month basis so that the billing team knows that what they're going to be billing, right? And so obviously those codes do depend on the complexity of care, right? The number of chronic conditions. So you'll just want to make sure that you have those ICD-10s down. And again, those 3 levels, level 1, GO 556, again, with one chronic condition, GO 557, 2 or more conditions, and then that GO 558, who are 2 or more conditions, but also a qualified Medicare beneficiary. So one more thing to make sure that it kind of is part of those 13 elements is that comprehensive kind of care plan that you've created, you do want to make sure that that's available electronically, right? It's in their EMR. The patient has access to it. The care team has access to it. You'll just want to make sure that that's kind of part of your documentation. So that will hopefully make it easy for you to identify the patients, put in a process, and start billing for this work. So my recommendation, pick a few patients, pilot this program, work through the communication plans, work through the consent process, which again, there's some sample consents through CMS that you can find online, and be able to train your staff so that the process works, that you also have some talking points for the patients around, okay, these are the services that are available. This is what you need to do in order to be able to have access to it, just to make sure that the program works well. And again, the intent behind all of this is just to help support patients with chronic conditions. Again, most of this time you're already doing this work. It's just a matter of being able to document that you can also bill for it. So by focusing on those high-risk OB patients, chronic GYN, and complex situations, you can bill for this and increase revenue, which is, again, the name of the game these days. So obviously, if you're listening to this podcast, I would love for you to share this with colleagues or other individuals that you work with. It helps us enrich and hopefully improve the lives of other physicians who are working out and staying independent. So hopefully you guys have all right. Thank you so much. Appreciate it. Talk to you next week.